And I'll turn it over to you to moderate our program and with Stacey.
Great. Thank you, Cannon. It's really terrific to be here, to have this opportunity. And I'm so pleased to introduce to our Rotary members someone who all of you know from afar, but I hope that you'll discover a lot more about her and her ideas for Georgia and the nation during the next 30 to 40 minutes. Stacey has extraordinarily deep roots, proud and long in Georgia, from Avondale High School through Spelman, through an extraordinary biography that includes private, public, and civic sectors. She served, as you all know, 11 years in the Georgia House of Representatives, 7 as our Democratic leader. And she was the 2018 Democratic nominee for governor in Georgia. And she ran an extraordinarily historic campaign. She was the first Black woman nominated to run for governor by a major party of any state. And she got more votes than any Democrat who's run statewide ever. And she emerged from that political battle as not only I think a pivotal figure in our own state, but certainly also as a national voice. And today she leads 3 organizations, Fair Fight, Fair Count, and the Southern Economic Advancement Project. And her work is really shaping both our state's discourse and also the nation's discourse on a whole variety of topics. On top of all of that, she has authored 7 works of fiction, 2 works of nonfiction. She's most recently been on the New York Times bestseller list for her book, Our Time Is Now, Power, Purpose, and the Fight for a Fair America. And again, on top of all of that, she's recently produced and been featured in Amazon's documentary, All in the Fight for Democracy. Which is bearing witness to her own political journey and also the ongoing struggle to ensure that everyone has the right to vote. And I'll just say on a personal level, I've known Stacey for more than 20 years. I've known her as a boss. She was a board member of Hands on Atlanta. She was and has been a business leader, obviously an author, a political leader. She's been a friend. And across all of that, I will say I have always known her as an amazing policy wonk and one of the very smartest people that I know. So first of all, Stacey, thank you for being with us at a really momentous and important time.
Well, Michelle, thank you so much for having me. Thank you to Cannon and to the Atlanta Rotary for inviting me. I want to start by level setting and talking about what it means to live in rural Georgia. You know, we're a state that has 159 counties, but 108 of our counties are considered rural. And that means a great deal when you then think about our healthcare. In the state of Georgia, 1.8 million Georgians live in rural areas. Access to healthcare, though, is limited. You've got 30 critical access hospitals. Those are hospitals that do not provide acute care. They're usually short term. We've got 89 rural health clinics, 146 federally qualified health centers, 47 short term healthcare access locations. But we've also lost 7 hospitals since 2010. And in the next 2 weeks, we will lose 2 more. 13% of Georgians lack access to health insurance. That's 1.4 million uninsured Georgians. And a large proportion of those Georgians are rural Georgians. We have 9 counties that do not have a doctor. We have 76 with no OBGYN, 60 that have no pediatricians. And we spend as a state $2.1 billion as of 2017 in uncompensated care, meaning those are costs that are absorbed by hospitals and then passed on to Georgians to cover those who do not have access to health insurance. Now, when you think about what I said about the number of medical facilities you can reach, 30 critical access, 89 rural healthcare clinics, 146 FQHCs, 47 short-term facilities. The problem is every single one of those facilities relies on Medicaid to cover rural Georgians who do not have private health insurance. And therefore, the refusal to expand Medicaid in the state of Georgia means that even though we have a unfortunately limited number of healthcare options, they are even more limited for those who do not have health insurance. That's why the number of actual hospitals matters so much, because that's the one place you can go to seek medical treatment where they have to see you even if you have no insurance. And so we have this challenge in the state of Georgia where our refusal to expand Medicaid is compounding a problem that has been growing for the last 20 years. We have a population that is booming in the urban areas, but we are not seeing the same level of support and investment that we need to cover 1.8 million Georgians. And COVID-19, I think, has demonstrated and put into sharp relief why this matters. As of last week, 5 of the top 10 counties with the highest death rates from COVID-19 are in rural Georgia. 12 of the 50 highest death rate counties are in Georgia, and 11 of them are rural. And we know that concentrated in Southwest Georgia, Terrell County, Early County, Randolph County, Calhoun counties, these are the counties that had the highest level of COVID deaths and COVID infection rates. In fact, they were so high that at one point during the summer, it was the #1 hotspot in the world. These are also the places where a number of those closures are clustered. In fact, on Thursday, one more of the hospitals for that 9-county area will shut down. And with the absence of Medicaid expansion, those who live in those communities who need access to healthcare, who need access to services because of comorbidities, they will continue to not be served. And I know you all heard this before, but I want to make sure we understand what we're talking about when we say expanding access to Medicaid. In the state of Georgia, to qualify for Medicaid, if you are not disabled or a pregnant woman or elderly, you must not make more than $7,000. We have a poverty rate in rural Georgia of about 20.9%, which is actually 7 points higher than the rest of the state. But making $7,000 a year means that you are too wealthy to qualify for the one health insurance program that covers the poor in Georgia. And so we are telling 108 counties, 1.8 million Georgians, that too many of them are too wealthy to qualify for Medicaid, to qualify for health insurance. And at the same time, we know that they are the most likely to contract the disease and to die in the state of Georgia, and unfortunately in the country. And so this has been an issue I've been fighting about and lobbying for since 2010. And I will tell you, this is a bipartisan conversation. I've worked with Democrats, Republicans, and independents on this issue because this is a matter not only of life or death, it is a matter of survival for so many Georgians. We know that when Wheeler County lost its hospital in Glenwood, 30% of its workforce lost their jobs. And we see this happening again and again and again across South Georgia. We do not have a plan that will adequately meet their needs. Now, I know recently the governor announced the approval of his 1115 waiver for Medicaid. But let's be clear about what this waiver covers. It expands access to Medicaid to between 50 to 75,000 Georgians at a cost of $218 million per year. But these folks who will qualify for it, they will have to prove employment or some other proof point. The challenge is that the unemployment rate in rural Georgia is only going to continue to increase, and doing so at a time where we know that the closure of small businesses, the closure of access to jobs is only going to increase as we suffer through and then recover from COVID-19, means that even that poor number of people, that 50 to 75,000 out of 1.4 million uninsured, will cost $218 million. But full expansion of Medicaid, as we have seen all but 14 states adopt in total. We have 2 states that are on the cusp of expansion. Medicaid expansion in the state of Georgia to cover 500,000 Georgians will only cost the state $200 million. So at this moment, we are deciding as a state under current leadership to spend $218 million to cover 50 to 75,000 people, rather than spending less, spending $200 million to cover 500,000 people. The math doesn't make sense. We also know that Medicaid expansion in the state of Georgia can have an incredible effect on economic recovery. If we were to expand Medicaid, even the most conservative estimates indicate that we will create roughly 50,000 jobs across the state of Georgia. Those are real jobs with real investment in communities, especially in rural Georgia. We know that if we do this expansion, if we fully invest, we will meet other states who've seen their uncompensated care rate cut by nearly 50%. In Georgia, we spend $2.1 billion on uncompensated care. We could cut that in half if we were to expand Medicaid. And so on the numbers, on the humanity, and on the practicality, Medicaid expansion makes sense. And as I wrap up, I will say this. When I ran for governor, and even before I ran for governor, I visited 150 counties before I ran for governor. I visited all 159 during my campaign. But I started visiting counties across the state of Georgia when I became Democratic leader in 2010. I became the leader at a time that, for politics purposes, was not the greatest time to take office as the leader. But one thing I had learned from my time in the legislature, from my Republican allies and friends, we may have voted differently, but we worked together, from my Democratic friends, was that I was not elected to be an Atlanta city representative. I was elected to be a Georgia state representative. And to me, that meant understanding the state. And so I've been to Wheeler County. I've been to Early and Terrell and Randolph County, but I've also been to Hayhira. I've been to Commerce. I've been to Rabun County. I've been up north to Catoosa County. And I know that no matter where you live in Georgia, people want the same things, especially rural Georgia. They want to be able to take care of their families. They want to be able to build a good life. They don't want to have to move to the big city to get access to healthcare or access to jobs. And they want to know that in a time of turmoil, we are all looking out for one another. The challenge we have with rural healthcare is that we are ignoring a growing problem that will not abate simply by doing a piecemeal solution. Only by fully expanding Medicaid will Georgia join the 30 plus states that have all recognized the truism of Medicaid expansion. It saves lives, it saves money, and it helps invest in the future. And so I will stop now and let you guys ask me any questions you have.
Thanks, Stacey. So I'm going to dig in a little bit more. I knew we would go right to a bunch of facts and a bunch of big ideas, and you did exactly that. And so I would love to hear a little bit about, I know you've studied other states. Can you give us an example of another state or a couple of states that you think are models, and then walk us through what's happened there?
So let's start with Kentucky. Kentucky expanded Medicaid and maintained that expansion under both Democratic and Republican leaders. In fact, it was one of the biggest issues in the 2019 election in Kentucky because it is a bipartisan commitment to maintaining Medicaid expansion. They saw their uncompensated care rate drop by more than 45%. They saw their rural hospitals actually stabilized, because we have to remember, as I said earlier, you will see this litany of rural healthcare solutions that have been proffered over the last 20 years. FQHCs, rural health clinics, critical access hospitals, which are cheaper and smaller than acute care facilities that we're used to in urban areas. But every single one of those medical facilities relies on reimbursement through Medicaid. And therefore, if Medicaid expansion doesn't happen, those entities are at risk, especially those hospitals, because the hospitals actually have to accept any patient that presents with an emergency. That's the uncompensated care rate. That's the bulk of it. And so what Kentucky has seen is that all of their costs have dropped. Their ability to cover more patients has increased. They have seen actual improvement in their healthcare outcomes. And we know that Kentucky is not considered, this isn't a partisan issue. This isn't even an ideological issue. It's been an economic issue. Another state that I use as a proof point is Indiana. Mike Pence expanded Medicaid in Indiana, and they have seen similar increases in their user rates, which actually have reduced their costs, because people who have diabetes, they get metformin instead of dialysis. People who face issues of, let's say they've got blood pressure issues, they get amlodipine instead of having to be on more expensive drugs, or more importantly, having to have surgeries that then cost a great deal more over the long term. And so in the state of Indiana, they have also seen an improvement in their rural healthcare access in particular, because both Kentucky and Indiana have really large rural populations that are comparable to Georgia. The other piece I would point out is that Georgia also has a concomitant strain of challenges, because unlike most of those two states that I mentioned, Georgia actually has one of the highest populations of rural communities that are communities of color. A third of rural Georgia is African American. And because of the disproportionate effect of COVID-19, we are seeing an amplified effect of the lack of access to healthcare in our state, because we know that if we expanded Medicaid in Georgia, we would cover 36% of those who would receive Medicaid are African American, 22% are Latino. And so what we know is that expansion of Medicaid, when you think about the effect it has had in those states, it would have an even more amplified effect, because the more disparate populations that need it the most are overrepresented in Georgia's rural population.
So, Stacey, I would like to dig a little deeper on the COVID manifestation of both the cleavages of within our society and also the healthcare disparities and what it's revealed for us in terms of the urgency of the need, but also any possible solutions like telemedicine.
So I'll start with telemedicine. The challenge for Georgia and a lot of states that have tried to turn to telemedicine as a solution, they run into two challenges. And for Georgia, it's particularly acute. In the state of Georgia, between 22 and 40% of Georgians do not have access to steady broadband internet. In fact, you mentioned one organization that I founded, Fair Count. We were working on the census. We took it upon ourselves to install Wi-Fi in 150 locations across the state. And in fact, some of our relationships were with rural health clinics that could not otherwise afford access to the internet. And so we know that the ability for telemedicine to intercede and improve outcomes, the promise is great, but the practicalities remain very difficult because so much of rural Georgia does not have access to broadband. A lot of you, if you've ever traveled south, basically once you get south of Macon, it's going to be a while before you get a cell signal, let alone you have the opportunity to actually hook into Wi-Fi. When you expand out to look at this through the context of COVID, we know that COVID disproportionately affects Black and Brown communities, African American, Latino, and we should not forget this also includes an Asian American population that is one of the fastest growing in the country, exists here in Georgia. And so those populations are seeing a disproportionate effect of COVID. We know it's a combination of issues. One is access to healthcare, meaning that for many, and I want to take a step back and say this. There was this, I don't consider it misinformation, but I would say it was misapplied. We know that comorbidities tend to exacerbate the effect of COVID-19. So there was a conversation a few months ago about the fact that it wasn't COVID that was killing people. It was these underlying conditions. The reality is people live with underlying conditions for decades. What happens with COVID is that it weakens the capacity of those who have those comorbidities to survive because they are now not dealing simply with one issue, they're dealing with multiple issues. The challenge then, when you do not have access to regular health care, those who do not have access to regular health care tend to allow those underlying conditions to get aggravated. And then when they contract COVID, they often will misread the symptoms or they simply won't have the ability to seek treatment. If you live in a county where the closest hospital is an hour away and there is no public transportation and you do not have an emergency that can justify the deployment of an ambulance, for many folks, they are simply going to wait until it's too bad and it's too late. And so we know that for communities of color in Georgia, they are more likely because of poverty, because of lack of access to healthcare, because of low wage jobs, and because of lack of an infrastructure, they are more likely to face the effects of COVID-19. And then when you layer that on top of just how high the population of communities of color are in the state of Georgia, especially in rural Georgia, you see the disproportionate effect that is unfortunately causing us to have an extraordinary infection rate and an extraordinary death rate.
So, Stacey, one of the questions that's come in is about maybe using the examples of some of the other states. The question is, what's the argument for not expanding? I'm asking you in some sense to make that argument that you are well aware of. And also, how has that been then overcome?
I will tell you, I am actually at a loss for why we are not expanding Medicaid. When I say that all but 14 states, we're still in a little bit of a holding pattern for Missouri, but Missouri voted to expand Medicaid. Utah has voted to expand Medicaid. We know that the remaining states that have refused to expand Medicaid, of those states, 9 are in the South. And almost equivocally, it has been based not on math, not on money, but on ideology. But the ideology is what confounds me, because there's this ideological belief that it's too much of a risk to serve people now because there may be a time in the future where the federal government isn't willing to keep up its end of the bargain and thus may end Medicaid expansion. But that is true of every single federal program on which we rely. The state of Georgia relies heavily on federal investment in almost every facet of our economy. And so the argument that we can't trust that the federal government will keep up its end of the bargain would necessitate that we not engage in agriculture, the military, or shipping and transportation. And so I don't understand it, other than there is a deep rooted and largely Southern antipathy towards providing this product. But it's a product that both business communities, Republican leaders in other states, healthcare leaders, they all agree that this is the only solution to what has been a problem that was created by lack of access and lack of participation. I truly am at a loss. I don't want to be pejorative, but other than meanness, I don't understand, because there is no mathematical challenge. The monetary challenge in Georgia could not be more direct. We will spend more money to serve a tenth of the possible population, as opposed to spending less money to serve 500,000 Georgians, nearly a third of those who are uninsured. I do not understand any equivocation that can justify it. And this notion that we can't predict what will happen in 10 to 15 years would argue against and cut against any other program we will or will not participate in.
So, Stacey, you mentioned the census, and you have engaged heavily in trying to ensure that we have a fair count for our populations. Can you just share why that matters? Why it matters for rural healthcare? Why it matters for our state and for our country?
Sure. So, after 2018, I had a little time on my hands, so I really wanted to focus on the democracy issues that I've been thinking about for the last 7 to 8 years. The shift in the work I did in Fair Fight to focusing on elections came about in part because of the 2018 election. But as you pointed out, I've been deeply engaged in conversations about voting rights, actually, since I was a student at Spelman, since I was 17. So this was not a new venue for me. It was just a new approach. But making certain that people have access to democracy through the right to vote is only one part of the challenge. A concomitant challenge are the inputs. And by background, I'm a tax attorney, so I believe in minutia and thinking about the pieces that no one else really cares about before they, nod off in boredom. The census is one of those things. We see it often as a, once a decade intrusion into our privacy. But as someone who was very embedded in policy before I ran for office, but also as someone who became Democratic leader during redistricting in 2011, when Georgia had an undercount, I was very acutely aware of the both economic impact and political impact of the census. But let's focus on the economic impact. Georgia is one of the fastest growing states in the nation. We will not achieve a population sufficient to gain us an additional congressional leader as we did in 2010, but we were pretty close. The challenge for Georgia is that when you do population counts, the census assumes, based on past history, that there's an entire cadre of residents who are going to be undercounted. They refer to them as the hard to count. Those are largely communities of color, rural communities, children under the age of 5, renters, the homeless, and immigrants. Georgia has a high percentage of all of those populations, and therefore the likelihood of an undercount was grave because we had one in 2010. And this year we knew it was the first time the census was being moved online. Almost entirely 80% of the census was to be completed online. We also knew that there had been an underinvestment in the number of people on the ground. And there was an elimination of the 30,000 question centers that existed in the 2010 census. So if you had a concern about the census, you used to be able to reach out and get someone to help you understand it. Those units were all wiped out. And so we were heading into a census that was already going to be constrained for the state of Georgia because a lot of the things that helped us get closer to a full count in 2010 were going to be gone. And then COVID hit. But here's why it matters. There are 300 programs that are federally funded that are allocated based on the census. And for Georgia's purposes, we need to think about the fact that that includes funding for roads and bridges, funding for Title I lunches and Title I education programs. It also includes disaster relief. When there is an undercount, disaster relief numbers are based on the census. And if we have undercounted the number of people who need relief in the midst of a crisis, and we have seen an increase in climate-related crises, or let's not argue about the source. We have seen an increase in disasters, natural disasters in Georgia, especially outside of what has been the traditional window for hurricanes. We know that we will not receive the monies for which we are eligible. This is also going to have an effect on any monies that are deployed from COVID relief. When we get into COVID recovery, the numbers that will be used to deploy dollars to our states will be based on the 2020 census count. And unfortunately, Georgia is one of the states that has a dramatic undercount. We barely crested over our 2010 our self-response rate, but we know that there have been deep challenges to the non-response follow-up rate that when people come and knock on your doors. Georgia, unfortunately, according to the Census Bureau, at one point had the two lowest performing, worst performing ACOs, or area census organizations in the country. It was so bad that at one point the map had to have a different color because of Georgia's undercount and underperformance. A coalition of groups, including my own, were able to boost the performance so that we came out a little bit ahead of where we were in 2010. But we should all be deeply concerned, because these are also the same numbers that businesses use to determine their future growth. These are the numbers that community groups use to figure out where they're going to do their investment and their placement. And then there are the political consequences that if you are undercounting communities, they will not have a voice in their political future. And that's just a danger, regardless of how they would vote. We deserve to have voters who pick their politicians, not politicians who pick their voters, or worse, politicians who do not know who their voters are.
Well, it's a powerful testimony to why it's so important. And so I want to do a couple of rapid fire questions because I know we don't have a whole lot of time. Tell us, we know that there's a lot of inextricable issues that are associated with poverty, and one of them is healthcare and in rural Georgia. But can you also just talk about maybe a couple of solutions that you see that you'd like to see enacted around specifically addressing issues of poverty, rural poverty?
Again, it's going to sound like a broken record, but we have to understand that rural poverty occurs for a number of reasons. One is that businesses tend to go where there are deeper populations, both for the capacity to hire the population you want, but also your consumer base. And so it is harder to get businesses to locate in rural areas. It is impossible to get them to locate in rural areas with no access to healthcare. And so Medicaid expansion, while it sounds like just health insurance, it's actually a jobs program. As I said, 56,000 new jobs created in Georgia. I know there were questions about why we have physician shortages. One of the reasons we have a physician shortage in Georgia is that no one wants to move to rural Georgia, in part because they cannot maintain their own practices, in part because they can't get insured patients to come to them. If we had Medicaid expansion, more doctors would be willing to move into rural areas because they could actually maintain a customer base and they would not have to go out of their pocket. We know that Clay County has one doctor and she has been paying for the healthcare of most of her community. And so the major solution for solving poverty begins with understanding education, economics, and healthcare. Medicaid expansion gets you two of the three. But the other piece is rural broadband expansion. If we do not expand rural broadband, we are going to continue to have a generation that is cut off not only from education opportunities, but long-term opportunities. And so we need to add Medicaid expansion and rural broadband. Those are two solutions that actually start to bring better solutions to communities.
So one of the questions that's come up is more about rural broadband and what that investment needs to look like, and how would you shape that?
So rural broadband is going to require the same kind of cost investment that we saw with rural electrification in the 1920s and 30s. We have reached a point where getting the providers to move into those communities, it's just difficult. It's a poor cost investment for our major providers, which means it's going to take a combination of state and federal action. Both parties have recognized this, but no one wants to be first with the dollars. And the investment is going to be much higher than people want to sustain. But I think we have to recognize that to solve these concomitant challenges of healthcare and education and business development, it will take a heavy investment by both the federal government and the state government. And this again is tied to the census. How much money we receive from the existing programs to fund rural broadband Those dollars are directly linked to the population count. Lower the population count, the less likely you are to achieve and receive the dollars you need.
So I want to do two more very quick questions. I can't resist asking you about. You've talked in your books and repeatedly about your own family from your grandparents on their quest for civil rights. We know at this moment of Black Lives Matter that we're at a historical inflection point. I wonder how you feel on the sort of hope barometer and any call to action that you would have for those of us who want to be in that fight.
So I tend to push back against the question of hope because that's not what drives me. I'm driven by legacy. My great grandparents were slaves in Mississippi. My great grandparents were sharecroppers in Mississippi. My great grandparents were domestic workers. My grandparents were cooks. And my parents were in the working poor despite doing all the things they were supposed to do. They had high school education, college education. And yet, because of racism and sexism, my mom made less money than the janitor who cleaned the college where she was the head librarian. And my dad, because of educational disinvestments, went undiagnosed with dyslexia for almost 30 years. But I was able, as you said at the outset, I was able to stand for governor of Georgia, the first Black woman to be a major party nominee in the history of the country. And what for me, that signals is the legacy of the work done before me. And that means that my obligation is to continue that work. I believe that Black Lives Matter. I believe our democracy is the solution to our triple threats right now of a healthcare catastrophe, an economic crisis, and a racial reckoning. And I believe the work is never fully done, but the responsibility is the commitment to doing the work, which is why I know everyone on this call is already registered to vote, already out there voting, but I hope you're going to encourage everyone you know to vote. And I want to thank the Atlanta Rotary for your program to encourage voting, not only amongst yourselves, but amongst your employees, giving them time off, encouraging them to use every method of voting, and most importantly, just encouraging active engagement in our democracy, because that's what drives me and that's what I believe in.
Well, that might be the perfect round out. I was going to ask you if there's a call to action to around the voting in Georgia. And we all know that we have a big challenge to ensure a fair and effective election. And so maybe any last words on that front for what we each can do. We all want to do our part, and then we'll hand it over to Cannon. But thank you for a terrific and inspiring and thoughtful set of reflections and ideas. As always, Stacey, thank you.
Thank you. Happy voting.
Well, and Michelle, Stacey, I don't know if you wanted to round out then. I think Michelle did say any final thoughts on the initiatives we're doing on getting out the vote, but I think you did cover that. But first, I want to thank you for joining us today. I mean, it is an honor to have you present to the Rotary Club of Atlanta. I know you presented 2 or 3 years ago as well, and certainly we'll look forward to having you back at some point. And Michelle, well done on moderating. Maybe just one large conceptual question, Stacey. So, if we, assume state and federal dollars are not unlimited, and you've outlined some very tough challenges that, do require bipartisan solutions at some point, but we've touched on health. We've touched on education and the digital divide. We touched a little bit on public safety, but not a lot there. But all three of those disproportionately affecting people of color, as you've outlined in the rural area. So these are intractable problems, challenges. There will be solutions. Bipartisan is going to be the best way to get it done. But just curious, if we don't have an unlimited budget at the federal and state level, how do you prioritize across those three? If you had only $1 to maximize to spend?
Well, your highest investment is the investment that can serve the most needs. Medicaid expansion is the most effective and efficient dollar, because that dollar then provides access to healthcare, which increases the likelihood of that person actually showing up to work. It increases the likelihood of that community being more stabilized. It decreases the likelihood of poverty related to healthcare issues, and it creates new jobs. And so every dollar invested in Medicaid expansion has been proven out across every single state that has relied on it as a part of their economic future. We know Medicaid expansion dollars solve many problems and then free up dollars, such as, again, that $2.1 billion as a state we spend every year on uncompensated care. Those are dollars that can then be reinvested in the other issues that I've laid out.
Well, great. Well, tough choices, and we appreciate you outlining your thoughts and view about how, ultimately the priorities should align. And so thank you. So we are at the top of the hour. I mean, Stacey, we could engage more conversation. This has certainly been extremely deep, extremely interesting. And the goal, again, just to inform and educate as we move through looking for solutions. So thank you both for a great program.
Thank you for having me.
Thank you.